title of the abstract is Schatzki rings are more commonly misdiagnosed in patients with eosinophilic esophagitis, presented by Sebastian Zecchi, with the authors being Sebastian Zecchi, Terry Wong, and Jason Dunn from Guy's and St Thomas's Hospital and the Comprehensive Cancer Centre, King's College London. Eosinophilic esophagitis is an increasingly common disorder characterised by the accumulation of eosinophils within the esophageal epithelium. This can lead to reduced esophageal distensibility and fibrosis, with dysphagia being the most common presenting symptom. The endoscopic findings can be subtle, with 15% of patients with EOE reported as having a macroscopically normal esophagus. The endoscopic findings can also look similar to other esophageal conditions. Schatzki rings are defined as thin mucosal fibrotic rings most commonly seen at the GOJ. They are common and can account for dysphagia in certain patients. Schatzki rings can be mistaken for fibrotic strictures of eosinophilic esophagitis, and it's therefore important to biopsy these rings and the esophagus to ascertain whether eosinophils are present. It's also recommended that all strictures are biopsied for the same reason. The aim of the current study was to assess what proportion of patients presenting for gastroscopy for any reason are found to have eosinophilic esophagitis when biopsied. All endoscopic and pathology text extraction was performed using the package written in R endominer. All free text endoscopy reports containing the term Schatzki and any spelling variants were identified. The presence or absence of strictures, as hiatus hernia, edema, trachealization, and white spots from the endoscopy report was extracted. The histopathology free text from any esophageal biopsies from the same cohort was analysed, and the results showing the presence of more than 15 eosinophils per high power field were identified as diagnostic of EOE. Medical records identified the sex, age at diagnosis, presence of atopy, and presenting symptoms of either dysphagia, including odynophagia and food bolus obstruction, or reflux, including atypical chest pain, heartburn, regurgitation, and symptoms consistent with the laryngopharyngeal reflux, such as chronic cough, globus, hoarseness, and throat clearing for each group. In addition, the endoscopies from all patients with eosinophilic esophagitis diagnosed at any point using the previously referenced diagnostic criteria between the 1st of January 2010 and the 23rd of January 2021 on biopsy from the esophagus were obtained from the pathology database. The results: 124 endoscopies where the findings described as Schatzki ring were identified between the 1st of January 2010 and the 23rd of January 2021. The average age at diagnosis was 52 years, with a slight male preponderance of 63%. Of these, 28% of the endoscopies showed an eosinophil count of equal to or more than 15 eosinophils per high power field on at least one biopsy. EOE Schatzki overlap patients were more likely to have a hiatus hernia as well as trachealization. The mean age at diagnosis was lower in the fibrostenotic EOE group, which was also more likely to have inflammatory findings of furrows, edema, and white exudates than the EOE Schatzki overlap group. In conclusion, Schatzki rings are more commonly diagnosed in patients with EOE and should be biopsied to confirm the presence of EOE. The Schatzki ring in a patient with EOE may represent a novel EOE phenotype, which is different to or a variant of fibrostenotic disease. Further work may be necessary to determine whether patients with Schatzki rings and EOE belong to a gastroesophageal reflux predominant type of EOE. Thank you.